For the purposes of for today's conversation, while I might be from the nation's capital and here to help you, I'm actually a rural, regional and remote patient because the services I need are not provided in my hometown. Over the last 15 years, I've been required to travel interstate as frequently as every 3 weeks, drawing out to about every 6 months. Rarely did a summary of my progress arrive in my GP's mailbox or fax machine, and therefore I was solely responsible for recollecting exactly what was said in a very complicated, twisted set of ill health. And while I am reasonably switched on, I'm trying to convince you of this, sometimes it is a bridge too far to remember every little measurement, every breath I have taken, every outcome of pathology. And sometimes, or quite often actually, there's been a trainee or a student clinician in the room and I would be asked to recite the onset of my illness, the various indicators for how bad things were becoming, when and where I had pathology and respiratory assessment, radiology and so forth. And it's just too hard to remember all of those things after some considerable time, let alone that there are things that I would rather forget, frankly. And don't get me wrong, I don't want to be seen as a whinger. I am the key person in the responsibility stakes for my health and well-being. However, when dealing with death and dying and having a little son and a gorgeous husband, as I was, it would have been really great to log on to my electronic health record and just double check the pathology rates, the spirometry, the gas transfer rates and so forth. At home now though, I can log on to the radiology provider to see my x-rays and to see a copy of the report, which is a marvellous thing because it saves me driving back to that provider a day or so later after the imaging and then ripping the big envelope open in front of the staff who are carefully stuck down that envelope and told me in a rather patronising tone to take it back to Dr. Dear. Actually on that I was during the height of my dreadful illness, I was at a 3-day appointment, as you often did, at a hospital interstate. And I was about halfway through the second day of appointments and had been waiting for quite a while and everything seemed to have halted. It turned out that the hold-up for the next appointment was that there was no orderly to take me to that appointment. I pointed out that I was ambulant and didn't need an orderly. Oh, yes, I did, I was told. The orderly would carry my medical record. I told the staff I could do it, and after much pausing and consideration, it was agreed that I could indeed take the record with me. It was popped into a large envelope and stuck down with araldite. I was told to go straight to the appointment and not stop anywhere to read the record. Guess what I did? Went to the ladies' loos. It took me some time to undo that envelope and I had a very quick read. Found lots of errors and then what could I do because I wasn't supposed to read it. But at the time, you know, it's interesting, isn't it? I was a CEO in the health service at the same time. I mean, not that I should expect any different treatment, but I was a CEO in the health service and I was told not to stop anywhere. But anyway, back to the matter at hand. The pathologist at home has also said to me that he'll fax or post my pathology results, but he won't email them because there's a risk of making a mistake in an email address. So there's no risk of making an error in the handwritten home address or the fax buttons, but there is with the email. And for those young people, and I see there are quite a few of you here who don't know what a fax machine is, go to your GP, they've still got them. A physio was telling me the other day that a certain chain of GPs at home had their fax machine die on them. Well, there's a surprise. But they still refuse to email requests and results to the physio. So I'm hoping that this newly established Australian Digital Health Agency that you can see there, its website address is digitalhealth.gov.au if you're interested. I'm hoping it'll be able to weave some magic and do something, anything, to move the concept of a useful electronic record being widely accessible to the long-suffering taxpayer soon. We've got good secure systems for to make our bank accounts safe, haven't we, to make sure they're not compromised. The tax office also has good secure systems, but we seem to have failed to progress this and I don't understand why. Is there anything we can do in the meantime, given that my radiology practice does allow patients to access their records? Is there anything we can do to help patients until we get this fabulous e-health record? is there something we can do for our rural, regional and remote patients whose health is already compromised through the tyranny of distance? One of the biggest furphies in the consumer engagement field is lack of health literacy of patients and how it leads to poor patient outcomes. As I mentioned earlier when talking about shared decision making, the patient is already an expert in their health care. They know what their values are and what their preferences are. It is up to the healthcare provider to work jointly and in partnership with the patient to ensure that the patient has a clear understanding of their health and well-being and what can or should be done to enhance it or lengthen it. Complaining about the lack of health literacy on the part of patients, I think, is a cop-out. We don't complain, or I haven't heard anyone complain yet, about my lack of mechanical knowledge impacting the health and well-being of this fabulous red sports car that goes really fast. And the reason for that is because I turn up routinely to get it serviced. The mechanic and I have a shared decision-making process in order for me to agree to spend a lot of money to keep it going. He tells me it won't go vroom if I don't replace the oil. It's good enough for me. Clinicians are expert in their space. Patients should not be expected to have a degree level of understanding of their condition, despite the fact that some of us have done that. And I'm not expected to have a degree level of understanding of the mechanics of my car to keep that going. So what does this all mean for the telehealth space at home? All of the issues are just as relevant in the telehealth or virtual health space as they are in the traditional environments of outpatient clinics, inpatient settings, or other consultation processes. I don't want you just to talk about patient-centred care or patient engagement, because the chances are, if you're talking about it, it's not coming as second nature to you. I want you to do it, to live it. I want to see places like Darling Downs leading in consumer engagement, which I'm pretty sure you are anyway, just listening already, so that patients can receive their health care in the setting of their choice. I want patients treated as we would like to be treated ourselves, with respect, courtesy and empathy. And I'm not advocating for 1 minute that patients are entitled to absolutely everything they may covet. Sure, there are rules around who gets what, but patients need to know what those rules are as well, to understand them in exactly the same way that clinicians need to understand that the farmer whose farm has just floated down the Guida River doesn't have the money to buy the most expensive, untested cancer-treating drug. We should be using all the tools at our fingertips to make things easier for patients, responding by emails where appropriate, using YouTube for demonstration of physiotherapy exercise or meal portion sizes or other activities that lend themselves to that social media, and using social media more frequently, not looking at Shane. Your patients are well ahead of you in the social media space. Hilariously, the AMA was critical last week of one of the health funds using a website to rank the services of clinicians around the country. I don't know if any of you saw that. But guess what? We've all been doing it for years. Facebook and Twitter. The AMA's objection to a health fund formalising such an agreement won't stop patients from telling all who will listen who the good surgeon or good dentist or good physio is in terms of empathy, compassion, wait time or billing. And my very last piece of advice to you, and we've come in under time, is take a bottle of common sense with all of this. 3 times a week. Thank you.